Come in.
Hi, Dr. Mitch.
Hi.
Cortney Robinson.
Nice to meet you.
How are you? May I have a seat?
Sit down.
Thank
of
you
course.
so much. So my cousin's new in the area, and she's a new patient of yours. Said that you're an excellent doctor.
Really?
I just wanted to give you compliments real fast.
That's always nice to hear. I don't get that every day.
No. Actually, I sent an agenda to your secretary. Did she happen to give it to you?
Got it right here.
Wonderful. Okay, I just wanted to give it to you early in case you had any notes or questions. You already knew what was going on. I know you're a busy man, so.
Yep, I had time to look over it, and yes, I am busy, so kind of looked over it to kind of speed the process along.
Perfect. All right, well, here's my card first of all. My name, phone number, email address on there. If everything goes well, I'll be able to get your prescriptions to you fast and easy.
Perfect.
And also, if you have any questions, don't hesitate to call, okay?
Absolutely.
All right, well, we'll start. You have the agenda, of course, but I just wanted to start by introducing treximet. It's also known as trexima. It's made from a manufacturing company called Glasgow Smith & Kline. Okay, we're a pharmaceutical healthcare company, and we're a company committed to improving the quality of human life by enabling people to do more, feel better, and live longer.
Sounds
Okay.
good.
Can we just get started by telling you a little about your practice, please?
Sure. I've been practicing for about 20 years now. I've been in the same area. There's kind of a network of doctors around here. There's about 5 of us that I'm really close with that we all talk about everything. So,
Okay.
I have, in my 20 years, I have less than a 5% turnover ratio, excluding, deaths, obviously. And my number one concern is about my patients.
Understandable.
And with that in mind, I'm kind of nervous about switching drugs because I've been using the drugs that I've been using this whole time, and I'm sticky about switching. So.
All right. Well, hopefully through this process I'll be able to answer your questions and hopefully make this transition a little bit easier for you and easier to understand too about what I do. And also, what are you currently treating your patients with?
Currently, I am using Imitrex and Maxalt, which is primarily headache and migraine relief is what it's used for.
All right. Well, treximet is a medicine close to Imitrex, except that it has an extra ingredient of naproxen, which of course I'll get to later. Okay.
Okay. With that said, if I like what I hear about treximet, would it be hard for my patients to transition from Imitrex or Maxalt to treximet? Is there going to be any?
Absolutely not. We just recommend that your patients go 24-hour period without taking any aspirin or their current migraine medicine. We like to get it all out of their system before transitioning to treximet.
Okay.
Okay, super easy. All right. What percent of your patients do you treat for just migraine problems? Would you say?
I'd say as a whole, probably about 25% of my patients are migraine patients.
Okay. Reoccurring, new?
Really, that I can't give you a definite percentage on that,
Okay.
but as a whole, it's about 25%. I'd say reoccurring is a little bit higher than the new ones.
Okay. Well, what do you do if your patient's current medication isn't working? What if it's not strong enough or not effective enough for them?
Well, if they're first time or second time patients, I'll recommend a higher dose. And it all depends upon the patient as well as how they react to the drug. And if for some reason my drugs aren't, if Imitrex and Maxalt aren't working, I will send them to like a hospital, get them a CAT scan, and get them actually checked out to make sure there's nothing more serious other than just having migraines.
Sounds scary.
And yeah, it is a little bit scary because you never know when
Yeah.
you're dealing with the brain.
Okay. So just so I understand what's going on, about 25% of your patients suffer from just migraines. They could be reoccurring or the first time.
Approximately 25%, yes.
Yeah. You currently use Imitrex and Maxalt,
Yes.
correctly? And for some patients, they're not working. If they're not, you're hiring their dose or just getting them checked out to make sure that it is a migraine problem and not another problem in their body, correct?
Yes.
All right. I just want to
That is
make
correct.
sure. Perfect. All right. Well, migraines are a significant problem for Americans. Actually, about 29.5 million Americans. Okay. With both neurovascular and inflammatory problems, treximet can actually treat both of these. Okay, so I'll go on by telling you that a little bit.
That's good to hear.
But by telling you all this, what if I can help you increase your patient's healing time by giving you a pill that is made by RT technology, which means it will burst apart and dissolve for faster relief for your patients. It not only helps migraines between 2 and 24 hours, but it can also help with minor headaches and also cluster headaches, so it has more than one use. How does that sound?
So what you're telling me is treximet is going to reduce the time it takes for my patients to...
Be relieved of their symptoms, yes.
Sounds good.
Okay. Well, going on, treximet is one pill that is made up of two components that work and treat the body in a couple of different ways. Okay, it targets the nerves and the blood vessels, which are believed to trigger the migraines. It's thought to reduce the inflammatory that can cause the migraine pain. And treximet approved after a double-blind study. 2 double-blind studies were done, I'm sorry. They were completely random. They were placebo-controlled, parallel group, and multi-centered study of more than 2,900 people suffering from migraine pain. Okay, please understand that there were side effects within these experiments, okay?
Okay.
But for more than half of them, the side effects were relieved, like I said, between the 2 and the 24-hour period. Starting at 2 hours for 24 hours.
Okay.
Okay? Like I said earlier,
So what percentage of your study felt the side effects? I'm just curious.
I'll get to that in a little bit, but only about 4% actually under 4% felt each side effect. But I'll go ahead and cover those in a little bit.
Okay.
Okay? And treximet, like I said, is made up of 2 different components. It's made up of 85 milligrams of Supatran, which is a headache medicine that affects the certain natural chemicals like serotonin in the blood vessels, which are around the brain. And then 500 milligrams of naproxen, which I said earlier is not in your Imitrex. Okay? And these are a non-steroidal anti-inflammatory drugs that work together to reduce the hormone which causes inflammatory and pain in the body. Okay? Treximet's available in a couple different strengths of tablets, 25, 50, and 100. And many studies have shown that treximet relieves migraine pain in 2 hours sooner compared to just sumatriptan, naproxen, and a placebo alone. So with these 2 combined, it helps relieve a lot faster.
Okay.
Okay? Do you currently have any questions?
Yeah, you were talking about the side effects. What are some of the side effects that were experienced?
Perfect. I will go over those for you really fast. So some of the side effects that include, there's a list actually down there for you. They include dizziness, nausea, sleepiness, dry mouth, chest pains, throat or jaw numbness. And like you had asked before, on the next page there's a chart. And each of these are broken down that were in our double-blind study. And as you can see, 4 is the highest number on the chart. So each of these had 4% or lower.
Oh, so these are percentage numbers?
Yes, 4% or lower of each of these symptoms. Okay, so it's not very high in the symptoms, but it just depends on the patient. So as you would know, you're their doctor, you know what they take, what they don't take. And then also in this packet that I'll be giving you later, it shows what kind of patients can take this and what kind of patients cannot.
Okay.
Okay, does that make sense?
Yes, it sure does.
Okay. Any other questions about side effects?
No, I don't have any more questions about the side effects. They all seem to be about the same as the ones I have. Are there any long-term side effects?
That's a great question. I'm really glad you asked that. Treximet is used preferably for short term. Okay, they're used to treat about 5 migraines a month. But they can cause problems because Treximet, it goes into blood vessels, of course, and it may constrict arteries. It can cause hypertension, heart, eye, and kidney disease later. Okay.
Okay. Well, I think that's about it for the side effects, from what I can think of.
Well, as I told you, the benefits definitely outweigh the minor side effects. With the relief of faster, pain, also being able to treat other headaches, not just migraines. Treximet is wonderful. It's wonderful. I used to get migraines all the time. And again, I just want to stress that Treximet cannot prevent migraines. It can only be used to relieve them.
Okay. Imitrex and Maxalt, on average, from what my patients have said, normally start relief within about an hour to 2 hours. If yours is if treximet is a lot quicker, so you're saying that it should start at before an hour, is what you're saying?
It should, but also a benefit of treximet is it lasts longer. It can last up to 24 hours, so it can give you that relief for your whole migraine that you would normally have.
Okay.
It lasts longer in your
And you
body.
said that's short term, so are my patients only supposed to take this pill short term?
No,
Or is this a long term pill that they can take while they're still experiencing migraines?
well, it's usually for patients who only experience about 5 migraines a month.
Okay.
Okay, any more than that, I'm sure it's up to the doctor's discretion.
Okay.
But it's based mainly for about 5 migraines a month.
Alright.
Okay.
Everything sounds good. Like I told you earlier, I'm a little bit nervous about switching right away.
Okay.
I do know a lot of my patients that I have, Imitrex and Maxalt seems to be working, and I do have some patients that it's not working for them.
Okay.
And I am interested in treximet, but I can't commit to it right now. Is there any way I can get some
Some free samples?
samples
Yes,
to
I can
use
leave
and-
some here for you. And then
I would also like to use these samples for about 4 to 6 weeks, just so I can get like a good amount of patients
Results.
in here. Because if I just did a week, I'm not going to get hardly any patients.
of course.
And I
Yeah.
want to see how they're doing and the side effects and all that kind of stuff before.
Would you like
I
me to
can
just leave
commit.
that with your receptionist on my way out?
Sure, that would be great.
Perfect. And also, I just wanted to ask if you had any referrals for other doctors. I know you said you're in a close knit of 5 other doctors. Do you mind if you could either refer me to them, give them a call, or actually give me
Absolutely.
their phone number?
When you drop off the samples to my receptionist, I'll just tell her to give you a list
Awesome.
of the doctors that's kind of in my network. So
Perfect.
that
All
sounds
right.
good.
Dr. Mitch, I just want to thank you for your time again. Here's a treximet pen.
Oh, perfect.
Okay. Have a great day.
Thank you.
Thank you so much.
Like to hear from you soon.